in the palm of your hand.
Kids across the country impacted by COVID and the Omicron variant. They're being diagnosed with croup, a cough that sounds like barking.
That's right. WPTV News Channel 5's Tanya Rogers spoke with a local pediatric expert.
I think you're right there.
Children ending up at the doctor's office, parents wanting to know if their child has COVID, especially if they think that their child has croup, coughing that sounds like barking.
It does seem that this is becoming what we call endemic or will be seasonal at some point once it settles out. And when it does, it will be likely that croup will be one of the typical manifestations that we would see in a child.
Dr. Chad Sanborn, a pediatric infectious disease expert, says in our area they are noticing a general increase in kids getting sick.
Certainly in other parts of the country, they are seeing a fair amount of croup and children who are COVID positive. So very difficult to distinguish, what's a common respiratory virus that we see every year and what is COVID at this point. Previously, a lot of bad respiratory distress, breathing really heavy, requiring oxygen. While that's still a concern, and we do see that sometimes, we're seeing a lot of other things, rashes, minor respiratory illnesses, and common respiratory illnesses like croup.
He says if you're worried about symptoms your child is experiencing, call the doctor.
I would presume if your child is sick with an illness, until proven otherwise, that there's a very good chance that they have COVID at the moment. There's no magic remedy for the kids at the moment. It's recommended rest, hydration, soup. Grandma's soup would be particularly helpful, things like that. But nothing special as it pertains to the coronavirus at this time in terms of treatment.
Tanya Rogers, WPTV News Channel 5.